Thanks, Darren. Hey, many people suffer with low thyroid, and the #1 cause is actually an autoimmune disease called Hashimoto's. Dr. Joshua Redd is here with Cherie, one of his patients, to explain exactly what this is. Welcome to both of you. Thanks for being here.
Thanks for having me.
We're hearing the term Hashimoto's, the diagnosis Hashimoto's more and more, but I think there's still some confusion about what it is exactly.
Yeah, what it is an autoimmune disease that actually attacks the follicular cells of the thyroid. And so what happens is that your body creates these antibodies and will slowly and surely start destroying the tissue of the thyroid. The only problem with this is that in the medical model, these patients are totally neglected. And so they'll give them the proper thyroid hormone, which is very beneficial for that patient, but it's doing nothing to the Hashimoto's. And so these patients still have a poor quality of life and still have the symptoms and just feel awful.
Well, a lot of women are aware now, and I think Oprah had something to do with that when she came out and said, I have a thyroid disease.
Yeah.
They're aware of the symptoms of thyroid. Are the symptoms of Hashimoto's similar?
They are similar. The problem with Hashimoto's is that they'll have hyperthyroid symptoms, but also hypothyroid, so low thyroid and hyperactive thyroid symptoms. So
tick through some of those symptoms for us.
Like anxiety, they'll have depression, inability to lose weight, they'll have like heart palpitations, they'll have restlessness, they'll have you know, lose their hair, things like that.
So what's the treatment once it's been diagnosed correctly?
Well, the main thing is get to the actual cause of the disease, and rather just, you know, instead of just neglecting these patients, actually figure out what's triggering the autoimmune response to attack the thyroid. And so we'll go in and do all extensive medical testing analysis and figure out to the T what's flaring this up, where the imbalances are, and then we work to restore those imbalances, and that gives them the best quality of life.
Well, Cherie, I want to hear your story. From what I understand, you came into the office seeking help for something completely unrelated.
Yes. I actually came to Dr. Redd because I wanted to reverse my type 2 diabetes, and I was on a lot of medications. And he did the extensive testing and all that he does for the for every patient that comes in, and we found out that I have Hashimoto's.
Was that a surprise to you? Had you heard of it before?
Well, I had low thyroid, so I didn't know about Hashimoto's. I didn't even know what it was. So when he told me, then he started working with that and started treating me for the Hashimoto's. And my diabetes automatically just started, the blood sugar started to decrease, and my A1C dropped from 7.3 to 5.7 within 3 months. And I went back to my regular doctor, and he took me off almost all of my medications. And I feel great. I have been doing really well with the program, and it's I don't have any fatigue anymore, no more headaches, no more foggy brain, and all the symptoms that come along with the thyroid problems.
So happy to hear you're doing better, feeling better, you look great. Is this typical?
Yeah, this is very typical. I mean, basically the majority of our patients will have this exact results, but that's because we're getting the mechanism of their disease rather than just treating their symptoms. I mean, there's so much that goes on with these patients, and so when you get to the cause, that gives the patient the best possible outcome.
So if people out there are connecting to maybe Cherie's story or what you've been describing, how do they get a hold of you? What's the first step?
Well, one, you can go onto our website at getlowthyroidhelp.com, or you can call for a free consultation to schedule a free consultation at 801-446-2822.
Okay, Dr. Redd, thank you so much.
Right,
Cherie, glad you're feeling better. We'll be right back.